you're doing, unless you're sweating a lot, then you may need more, you know. As we age, we tend to lose a hormone, desmopressin, I believe it is, and what that hormone does is it keeps the kidneys active all the time, and so as we age, we tend to lose that, so sometimes when we lay down, the kidney becomes kind of active. So it's fairly common that we produce more urine at night as we age. That's why it says it's normal for someone to get up only once a night before the age of 40. Then it's normal for someone to get up twice a night after the age of 60, because you know it's a known effect of aging, and our kidney kind of gets more active when we lay down. So if that is something that happens, there are things that we can do to help the bladder process a lot before you go to bed, and there's little tricks that you can do for that. If you know that you swell at night or during the day, and then so you're in the morning, your feet and ankle are much less swollen than towards the night, then one trick is to, before you go to bed, I like to do 2 hours before you go to bed. Normally, if you're just watching TV, elevate your legs. Basically, trick your body like you're going to sleep, but you're not. You're watching TV, or you're reading a book, or you're talking, or whatever. And elevation is not this. It has to have your legs above your heart. So you have to have your legs above your heart for proper elevation.
You can have your legs above your heart.
And then while you're up there, you just kind of pump your legs. So you can be doing that while you're watching TV or whatever. What that's going to do is it's going to help move that swelling and the interstitial fluid out. The kidney's going to process it before you go to bed, and then that way you can then pee, of course, before you go to bed and go.
Does the bladder shrink with age?
Depends on whether you're talking about functional or physical. Functional, yes, meaning can you train your bladder to shrink with age? Yes. Prostatic bladder is a bladder that's probably gotten gnarly, meaning its expansion, its ability to fill up like a balloon has decreased because just over time that prostate has blocked urine sometimes. Did you find that it's more difficult to urinate? People who have cancer. Are you finding that at all? Did you have any symptoms at all prior to getting diagnosed with prostate cancer? Yeah. Did you notice anything?
No.
Okay. So sometimes, did anybody notice symptoms of being having more difficulty peeing? You probably did because your prostate. Yeah. But, so that can be a common effect where,
I didn't have any symptoms for going to the bathroom in the middle of the night and everything else with the prostate cancer.
You did not? Okay.
It was the PSA that determined it.
Okay.
Yeah, same here. PSA.
It's not uncommon with BPH and or cancer to have a little bit more difficulty urinating, just because the bladder is not contracting as well. And so then it's more difficult to empty sometimes.
I'm not here.
That's not the case.
So Kris, would you talk about nocturia? That's where you have to get up all the time?
Yeah.
Yeah, I get up like hourly.
Hourly. Now, is that something you had before?
I gotta sleep in the
The
bed.
search, so only, did you have prostatectomy?
Yes.
Okay, and did it happen after that?
It started maybe like a year ago,
And how long ago was your prostatectomy?
2016.
So between 2016 and 2018, it wasn't a problem. So this is a new problem.
Right.
Have you changed your lifestyle at all? Are you drinking before you go to bed? Anything like that?
No, nothing's changed.
All right, so then you're just having what we call just an overactive bladder. So your bladder, for whatever reason, is not wanting to store as well. You can retrain that by, first off, what I would do with you is have you fill out a bladder diary. And all that means is you actually measure how much you urinate for about 2 or 3 days, just to see what is your average capacity. I would probably also, do you have any difficulty urinating?
No.
You don't have to push?
No, and it's not a lot either.
It's
you know.
not, so
No,
you
it
probably
wakes,
just,
wakes you up, you know, and hard to get a good night's sleep when you're getting
oh
up every
yeah,
hour.
definitely, and sleep is so important, and you're not getting a restful sleep at all. So if you have a small bladder capacity, what I would do with you is I would teach you urge suppression techniques during your day, If we can increase your bladder capacity during the day, that's going to follow through to being able to store more at night also. So we'll just be teaching you bladder retraining habits. It's pretty simple if you want to visit. Or talk to me afterwards, and I can go over it in about 10 minutes, okay? All right, so for somebody who is having a lot of nighttime urination, the big thing is trying to get good hydration in the beginning of your day so you're not getting dehydrated. And then 2 to 3 hours before you go to bed, don't drink anything at all. That's an important part. Do you swell during the day, at night, or during the day? Do you notice any puffiness in your
Yeah, maybe.
All right, then I would do the trick where before you go to bed, you put your legs up above your heart and pump them while you're watching TV or reading a book or whatever, and then make sure you pee before you go to bed. Do that for a good 45 minutes to an hour before you go to bed. And then we can talk about some other stuff. Or I can go talk about it right now if you guys want to, for the urge suppression techniques. I just don't want to waste your time. Okay. So I'll do it, so I got it up here, so I'll go over. So urge suppression is basically giving notice to the bladder. You're going to treat your bladder like a 2-year-old having a tantrum, meaning that it's wanting to go into its emptying phase, and you say, no, you can't have what you want until you basically calm down. So if you're in the habit of, as soon as you feel like you have to pee, you go into the toilet, what you do is you recognize, you can sense that my bladder is starting to talk to me. You sit yourself down, because the first thing that does is it tells the bladder you're not going anywhere. Okay. While you're sitting down, you use the central nervous system to calm down. So you take some deep breaths, and sounds funny, but you talk to your bladder in your head. Don't say it out loud. You just kind of say, okay, bladder, here you have to go. You're just going to have to calm down. I'm in control right now. And then you do some Kegel contractions. And that's the only thing I wouldn't be able to do with you tonight, is making sure you know how to contract the pelvic floor. Because again, the pelvic floor, again, talks back to the bladder. So when you relax your pelvic floor, even further than what you can do right now, autonomically or automatically through the brain, when you're trying to pee, your pelvic floor even drops further than what it's doing right now. You just can't do it purposely. And that's what cues the bladder, oh, it's time to contract. So we use that. It's called the vesical inhibitory reflex. We do it just opposite. We want the bladder to restore. If we contract the pelvic floor, and that tells the bladder, oh, the door's closed, so bladder, stop squeezing. So all those 3 things together, you're not triggering it by walking to the toilet. You have used central nervous system to calm down the bladder contractions, and you've used that reflex to calm down the bladder contractions. The bladder is now back in its storage phase. You may still sense that you have to pee, but it's not as strong. And now you can walk towards the toilet in control and not feel like you're going to leak. Now, for somebody who has a small bladder capacity, you use those urge suppression techniques to go longer between voids, because then your bladder is trained to basically functionally improve its capacity. And within 2 to 3 weeks of increasing the time between voids over time, then your bladder is storing more. And hopefully then follows through being able to do that at night also.
How much fluid does the average bladder hold?
Great question. The research says, maybe bladder?
Yes.
Research says they should be able to store 9 to 12 ounces, which to me, that's like a cup to a little cup and a half. And I know the bladder can do a lot better than that, but that's what we try to get to. So the average is a cup and a half, but you should be able to store more. That's the low end of normal to me. So stop moving. Basically, sit down when you get an urge to go. Relax. Calming message of the bladder. Treat it like a 2-year-old having a tantrum. Pelvic floor contractions to calm down the bladder contractions, and then walk confidently to the toilet. So pastry, that's for women. Guys
And do
don't
it like
have
hell.
Yeah.
All right, so I am open to any questions you may have. You got it all, huh?
My experience was, I had urge incontinence, about that, but just standing up, or even after having gone to the bathroom, continuing, you think you're done, but you're not, and you continue to.
Like dribble?
Oh,
That's
yeah.
my issue.
Yeah,
Yeah, I
so
have that
there's a
issue too.
post-void dribble, is what it's
Yep.
called.
Yep.
And there can be many reasons for that. Of course, with men, the urethra is much longer, so your bladder could have stopped contracting, and your pelvic floor muscles have come up, but there could be still urine left in the urethra. So there's milking techniques you probably were taught how to do to help with that. If the pelvic floor muscles have some weakness to it, sometimes that can be an issue too. So with post-void dribble, for men, what I would teach them to do is the milking technique, or when they're done urinating, to do double void, and that's just whether you're standing or sitting, you change positions. While you don't walk away from the toilet, you just sit down and stand back up, and it just like reboots, because the bladder may not be done emptying yet, especially if you're in a hurry to get out the toilet and walk away. You gotta give it time.
Chris, could you address techniques for people that have to get up at night a lot to go to the bathroom? What would you do to schedule your day, et cetera?
Do you have the same, is the urinary frequency also during the day?
That's what I'm trying to go through in my own mind. It
Yeah.
sounds like I should drink a lot of water during the day and stop drinking anything.
Yeah, you want
2 to 3 hours.
Yes.
And that might completely modify.
It might help your kidneys process what you have drank before you go to bed.
Yeah, because now my urologist is a great surgeon, but
Yeah.
he's not been able to help me other than give me some pills
Yeah,
to try and get
yeah,
it so that I can sleep more.
right.
So
And
maybe
then-
you might be the right person to give me some tips on that.
Yeah, well, the pills are usually, they're like bladder medications, like
Yeah, it's the
Dettol.
standard, whatever they,
Yeah.
they throw at you.
They can be helpful, but they also have some pretty heavy side effects to them sometimes too. Did you try them yet? The bladder
Oh,
meds?
I've been on it ever since my surgery in 2016.
Have they helped that?
Well,
nighttime?
I've never been without them, so I don't know if
Oh,
they.
Yeah.
Maybe
Are
I
you
just have to
Yeah.
take myself to the toilet if I didn't take them.
Yeah, well, it would be interesting to see what would happen if you weaned off, because oftentimes, those are medications doctors give somebody and they work, and then they just continue taking them forever, whether or not they're doing anything for you at that point. And that's something that, it's sort
Well,
of,
I'm thinking my behavior might be more of an impact than
Yeah.
the pills.
yeah. The bladder is a habit organ, so if you give it the habit of urinating frequently, it's gonna wanna continue doing that, because then the bladder literally has functioning.
God bless.
Well, I never heard
I
that
got
from
around
any of my
water
many
sometimes, like, you
Doctors-
know,
doctors.
They don't usually talk about it.
Okay, no,
Yeah.
that's new
I want to ask
information.
her,
Yeah.
sometimes I'm
Yeah.
not working and
So
nothing
the
like
rest
come
of
in, I
this
run
is
cold water, that gives me
The
the
fact that
signal.
you shouldn't be drinking
No,
coffee, da.
Yeah,
Alcohol, they all suggest that.
right. So learning how to treat your bladder to store better, that's, if you want to be able to go longer between voids and not have to urinate as frequently,
Yeah.
then that's the behavior you need to start getting your bladder to
It
do.
would seem to me, if I want to just extend this for, not everybody, I should be drinking a lot of water and expanding my bladder and trying to go longer
To
periods
get, to
of time.
literally get used to
Like a
holding
muscle,
more.
trying to
Yes.
develop, okay.
Yes.
And then at night, stop drinking, eating, doing anything for 2 to 3 hours before I go to actual sleep, and see if
Right.
that impacts my sleep habits.
Right, exactly right.
I've got to have
And
my
I would
scotch at
also start weaning down off
Yeah,
the
you gotta
bladder
use them, take
medication.
pills.
Do you have any constipation issues?
No,
Oh, good.
I feel fine, but
Good.
I'm just saying I would like to be able to
Yeah,
not get up. And-
Yeah.
And it's very common for people that are even doctors that are my friends, they get up and I go, well, is there anything that you can do to change that? Oh, yeah, take these pills. So
Yeah.
I'm giving you the
Yeah.
standard procedure.
Yeah,
All right,
that's what they're trained to do.
thank you. Okay.
Yeah.
What's a typical course of treatment if I was to get referred to you?
It would be, talk to me for about a half an hour, getting a history, finding what your symptoms are, what your goals are, and then figuring out what is the best plan of treatment for you. So if depending on what your symptoms were, I would address those symptoms. So most often it's going to be a pelvic floor evaluation to see how well you know how to use those muscles. And then if we need bladder training, we get you the bladder training. We would check your strength, your endurance. We check to see how often you're urinating, that sort of thing. So first visit is a lot of talk, but getting you started on a home program. I like to keep visits to a minimum. I like to get as much patients to do as much as they can at home. It's not what I do to you in the clinic, it's what you learn and go home and do. So usually within 3 to 4 visits, you've tapped out whatever I can help you with and go from there. Yes?
Years ago, younger, going to the football games, up at the Husky Stadium, stuff like that, we come back, we go to the club, we eat beer and pizza, there's 4 or 5 of us, picture, and all that stuff. And then it seems like you don't have to go to the bathroom for quite a while. You go at one time, all of a sudden you gotta keep running back and forth. What happens there?
So you're talking about you go out drinking and drink a lot of beer, and you can hold a lot of beer for many, many hours, but as soon as you start peeing, they have to do it more and more and more. Is that what you're saying? Probably, it sounds like you cleared your kidneys and now it's just like straight to the bladder. I don't know. It goes beer to beer.
Those are the younger days, we
Yeah.
can do it.
All right.
Well, there's a lot of things you can do in your younger days.
Now it takes 1 beer, I'm hearing. 1 beer now.
Yeah,
Once
come back.
5 years
Well,
after
I could have a
my
couple
bladder
of them.
prosectomy, roughly 4 years ago, at night, there was always seepage.
Urinary seats?
Yeah, right.
Okay.
And so that happened about 6 months after my first surgery. And it ended up being scar tissue over the urethra.
Yeah.
So I assumed it was going to be that. So I went to Dr. Kim, and he had me to go to the bathroom and empty my bladder. Then he put the machine on my stomach.
Mhm.
And he said, the problem is, you're not
Yeah.
delivering all of it.
Yeah.
Give me some pills,
Yeah.
Ultrasound.
and that didn't change things. Then he had me to use a catheter. So
Yeah.
every night before I go to bed,
Yeah.
I use it.
Yeah.
But it's interesting, it only happens when I'm relaxed. You know, during the day, I don't have any problem. I'll come much water, drink, whatever. But the moment I sit down and relax, not sitting up, but kind of leaning, that's when I can get some sleep. But when I remain normal,
Yeah.
and I do the catheterization at night, I have no problem.
Okay, so what's happening there is your bladder's not emptying well, right? So that bladder scan that they did determined that when you peed, when you think you're empty, you're not. And so then your bladder just, it's the gnarly bladder syndrome thing, where the bladder's not contracting really well to get it out, plus the scar tissue acts as a restriction for that bladder emptying. So when you catheterize, it empties. So what was your question to me again? Why does it happen when you lean back
Yeah,
and not when you're sitting up?
right.
That's a fairly common that I've heard from patients. And the only thing I can really think of is when you're sitting up, you have already some pressure up against the urethra just from the chair, and it's blocking it. But when you lean back, you're not, there's no support there. That's the only thing I can think of. Does it happen when you're standing? Do you sleep when you're standing and walking around?
I don't have any problem.
Okay. But I'm not sure what's going on
If you're thinking about getting a prostectomy because you've been diagnosed with cancer, should you consider getting a pelvic floor evaluation before?
Studies? Yes.
But I don't know that that's consistent with doctors or surgeons.
Well, it all depends on how progressive the doctor is.
Yeah.
There's a lot of evidence and research that shows that if you do get your pelvic floor muscles as strong, just like if you have, I don't care what surgery you have, let's say you have a total hip or a total knee, the better off your muscles are before your
that's true.
surgery, the better you're gonna be when you're after the surgery.
Yep.
So if you're learning how to use your muscles
I did
prior
that
and
when
you're
I had
strengthening them up,
meniscus
you know
surgery.
how to counter brace, and you
yeah.
know the time, and you're using the right muscles, chances are you're going to be better off after your surgery, or you're gonna rehab much faster.
So it's something you should ask for.
I think it is something you should ask for by all means, and it's not a lot of visits. We're talking, you know, if you're good and get it done, 1 or 2 visits, and you can learn a lot in those visits.
Is your evaluation process of how well someone is doing that
Yeah.
exercise involved, like rubber glove, or is there? How do you-
Yeah, it is.
Did
It's like a very light prostate exam. You don't
Yep.
have a vagina, so I can't use that. So it is a rectal test where you only have to go in just enough to, you know, get the rectal sphincter.
Yeah.
And what you're testing for is the right muscle being contracted
Squeeze.
and how smooth and coordinated it is. Can you relax well? And when you push, does the muscle bulge? Does the muscle have a normal range of motion too, is what you're looking for. Nothing painful. You guys have had so many
Oh, yeah.
rectal things. Nothing. Absolutely nothing.
Yeah, it's not
Do
calm.
you do any electrical measurement, diodes or anything like that?
Well, you can use biofeedback, a surface EMG. I don't tend to use it a lot. It's not necessary. It's nice to be able to see it, but if you can train somebody how to do the contractions without it, it's just extra. I tend to use surface EMG with rectal sensors if somebody has tension they cannot recognize they have, and that's good feedback for that. But it's not, I don't think it's necessary for strength. Yeah.
I know a phlebotomist takes blood and a urologist
Start over
checks.
again, what'd you say again?
A phlebotomist takes blood,
Yeah.
a urologist checks your organs,
Yeah.
a pulmonologist checks your lungs. What are you called?
A physical therapist that checks pelvic floor. I'm a PPPT.
Oh, I thought maybe there was a medical term for it.
No, it's just pelvic floor physical therapy.
Where's your education at?
I went to PT school in St. Louis, Missouri, at a small college called Maryville University. That was 1983.
What brought you out here?
I grew up out here.
Oh.
Back then, you go to PT school wherever you're accepted, that's where I was accepted. So I moved out there and came right back after I was done.
Where's your office? Where do you?
I am at CHI Franciscan in Lakewood, St. Clair, and we have 2 pelvic floor PTs, Anna Johnson and myself. There's also pelvic floor PTs in all the Franciscan, like in St. Joe's, although I don't think she sees males. I'm sorry. So there's St. Francis, although she's on maternity leave. So.
There's you.
There's Elizabeth, St. Elizabeth's in Gig Harbor. There's a pelvic floor PT there. Pretty much any hospital-based clinic has multi-care. They have pelvic floor PTs. There's some private practice that has pelvic floor PTs. Just ask if they see males, because many female therapists are not comfortable seeing males. So sometimes they limit themselves to females. So just make sure that they do see males.
I have a question. I was here, a few minutes ago, and I don't know if it was you or not, was talking about exercises that don't help, not Kegels, but other exercises that don't help the urinary incontinence. One of them was the body solid where you bend down and come up, I kind of remember. Are there any others? Like I do sit to stand 3 times a week with my routine. I do planks.
Anything that gets you moving, walking, swimming, biking, those are all good exercises. Yeah. Well, they help to keep your overall body strong,
Yeah.
and that's important.
But do any of them work against?
None of them are going to specifically
Since that
address
walking
the
thing,
urinary incontinence
But do
mechanism.
any
Yeah.
of them
I've been doing
compare?
40, 50,000 steps a week.
Nope.
Good for you.
I don't think so.
Of course, I had an exceptional day today.
Anything else?
Them.
Yeah.
I can't get.
Thank you very much.
Yeah.